Today I'm going to talk about the importance of treating cognitive and emotional dysfunction early in recovery. Um, uh, when people enter into recovery and are needing to be abstinent from substances they've been using sometimes for years, there are different states that exist because of this. First of all, from an emotional standpoint, people have been relying on substances as a coping mechanism for years. And sometimes they've been using substances to treat depression, sometimes for anxiety, sometimes to treat trauma syndromes. And when they come into recovery and are expected to be abstinent, they're giving up basically their coping strategy. And at that point, it can become flooded with very intense emotions without having had time yet to develop coping mechanisms to deal with these extremely painful emotions, very deep painful emotions that they've been struggling with for years in some cases. And sometimes these emotional states can overwhelm them to the point where it can make it hard for them to function in recovery or even continue in recovery without some intervention. And they may have panic attacks, flashbacks, become highly emotional and agitated when they are not able to cope. They can decompensate because of their feelings getting hurt and not having ways to protect themselves, their self-esteem, their self-worth. And to some degree it becomes unrealistic to expect them to be able to handle these situations effectively or maturely early on. And because of this, often they are going to need some pharmacological help, whether it's treating their depression or treating their anxiety. Cognitive behavioral interventions are not going to be highly effective early on, although they can be effective as they progress over time and as things settle down and they get farther along in their recovery. At Haven, since we are dosing daily under supervision for 6 months, it becomes a lot easier to use medication in these circumstances because it's supervised and they're taking it in front of someone, and so the chances of abusing it are much less. And so we will use benzodiazepines when needed for panic anxiety or PTSD anxiety, and obviously antidepressants have less abuse potential, but there are clearly situations where that is warranted. Otherwise, people will be lost to recovery. They'll bomb out of recovery basically because of interpersonal conflicts, or just start using to deal with their problems and keep having positive drug screens and be released because of that. So there needs to be some degree of flexibility in dealing with these types of issues early on, and as there is a progression, then these types of medicines in some cases can be tapered, and as people are more settled emotionally and other changes are occurring, and they can respond to other types of treatment, including therapy and progress in the steps. From a cognitive standpoint, the effects of chemical use on the brain can really disrupt cognitive functioning. People can come in and be cognitively slowed down. They can have a lot of trouble being focused, organized, being able to sustain attention, being alert, and yet they come into recovery expected to be able to sustain attention and to be alert and organized and attend meetings and pay attention to the content and gain from it, to be at meetings on times, things like this. But it may take them months before their brain chemistry re-equilibrates to more of a natural state. It may take even a year in some cases, depending on what people have been using and how long they've been using it. And so whether people have a bona fide ADHD syndrome or not, some people may have an ADHD-induced syndrome or an ADD-induced syndrome, or cognitive dysfunction induced by their substances, that may benefit from the use of psychostimulant medication that will help them be more focused and organized and alert, and will help facilitate their attending meetings and being alert and focused and participatory and motivated and gain from being in recovery early on. Whereas if they're left to their natural recovery state at that point, they are going to be very dysfunctional on a cognitive level and appear to be unmotivated and kind of blowing off recovery, not caring, having a bad attitude, and in some cases getting to the point where they're released from recovery because of misinterpreting what's really going on with them at that point. Again, since at Haven we dose people under supervision for the first 6 months, it becomes easy to use a stimulant medication in people early in recovery because they're taking it daily in front of someone, and so the potential for abusing it is very low at that point. These are just two aspects of dysfunction from drug use that people come into recovery with, emotionally and cognitively, that can greatly interfere with their ability to progress early in recovery, can interfere with their ability to make progress in recovery, and can make them look like they don't care about recovery or are unmotivated to recover, or that they're not invested in the recovery. And mistakes can be made about interpreting, making these interpretations about people. And if you think outside the box and look at intervening pharmacologically to address some of these problems, it can make or break it for individuals in terms of their recovery. And so that's what we try to do, and we find success in a lot of cases by doing that.